Hey, are you looking for treatment considerations for Lyme disease that doesn't involve antibiotics? If you are, this video is for you. Hello everyone, Dr. Jason West with the Lyme series, and we're going to talk about the treatment of Lyme disease with or without antibiotics. Now, to just give you a little bit of background, what got me into Lyme disease is my dad got really sick about 10 years before he died. He didn't die from Lyme disease, he didn't have Lyme disease, but why it's so important is because it led us to a pathway that helped us discover a treatment for Lyme disease, a combination of vitamin C therapy, ultraviolet blood irradiation therapy, neural therapy, healthy cell therapy, mind-body healing, and basically body touch therapy. So when you combine all of that together, it's not what we do that gets the outcomes that we have, it's how we do it. So we take all of that stuff together and we put it into an amazing healing package for Lyme. Now, Lyme disease is a vector-borne illness that basically what happens is you're bit by a tick, you can get a bullseye rash or a fever, and you can get symptoms. In the upcoming video, I'm going to talk about the transmission of Lyme disease because I think there's more to it than just a tick bite. That's my opinion. It differs significantly from the traditional medical thoughts on Lyme disease, but let's specifically talk about treatments and antibiotic therapy for Lyme disease. So Lyme disease is recognized as a bacteria. I think that there are other phases or life cycles of Lyme disease, and that the antibiotic approach really helps with the spirochete phase or the acute phase. And the traditional medical treatment for Lyme disease is doxycycline or Rocephin, and then some doctors are adding different types of antibiotics to that regimen. And the antibiotic word, when you break it down, it means anti-life therapy, and it goes and it kills the bad guys. One of my favorite stories to illustrate that point comes from the movie Jurassic Park. So they invented this way to extract DNA from dinosaurs. They put together a park, and then they bring in a dinosaur specialist and a mathematician to evaluate the park. And as the mathematician, Jeff Goldblum, as he's walking through the park, what's happening is he says, how do you contain the dinosaurs? And the scientists looked at him and said, we've engineered these dinosaurs so that they're deficient in amino acid, and if they don't get it from the diet, they'll die. And so they're really depending upon us to live. And the mathematician turned to him, one of my favorite lines in all the movies, he says, that isn't going to work because life finds a way. And it's the same with Lyme disease. If you start hammering, or when you start hammering Lyme disease with antibiotics, what happens is the bacteria that causes Lyme disease, it finds a way. And it either changes life cycles and goes into the spore phase or the intracellular phase, or it can become immune or resistant to the antibiotics. And so I'm not opposed to antibiotic therapy. Matter of fact, when it comes to Lyme disease, what I tell people is whatever is working for you, you need to keep doing that. But sometimes I've seen people come in that have been on 3 years of IV antibiotics and 2 or 3 or 5 years of oral antibiotics, and they seem to be better than when they started, but frequently they hit a plateau, or in some cases they develop unwanted side effects from the antibiotics. It's really hard on the gut and the proprioceptive nerve endings, and so people have balance problems. They get disoriented very easy. If they stand up too quick, a lot of times they get lightheaded. And those are just some of the things that I see from long-term antibiotic use. I think a better solution is to stimulate the immune system, or possibly incorporate a short-term course of antibiotics for some people and then get them on an immune system stimulating therapy. I've seen really good outcomes in my office, and I prefer to treat without antibiotics. And so people say, well, if I have this infection, what are my options? Now, some of the easiest ways to identify what your options are is to know what your immune system is doing. This can be done with a simple blood test, a complete blood cell count with auto differentiation. You want to see what is your white blood cell count. In an optimal world, it should be between 6 and 8. And then you want to look at the fractions or percentages of your white blood cell count, which is the neutrophils, the lymphocytes, the monocytes, the eosinophils, and the basophils. And it should be in a ratio of 60, 30, 8, 3, 0. Matter of fact, the mnemonic I use for that is 60, 30, 8, 3, 0, never let my engine blow. And those different words mean basically the bacterial fighters, the viral fighters, the inflammatory fighters. So if you have a blood test and your white blood cell count is between 6 and 8 and your neutrophil count is around 60, it means that your body really isn't recognizing or processing the Lyme infection if you still are having symptoms. So that's one indication or one way to identify, is your body responding to some type of infection. Now, other consideration on blood tests, you just want to have a nice overall panel, a complete metabolic panel. Look at your liver enzymes, your kidney enzymes, your trace minerals, your blood sugar, your pH, your kidney filtration, and you want to go after the organ system that is showing any type of problems on the blood test. Now, there's lots of different blood tests that you can use. You can go into a higher level of immune system function by doing a CD57 test. We can do a vitamin D panel to see what's happening on your vitamin D side. And there's lots and lots of different additional higher end tests. Now, with the consideration for antibiotic therapy, if you've been on antibiotics for a long time and you're not improving, it's time to do some different type of immune system stimulation. And this is where I see some really good treatment outcomes using high dose vitamin C therapy. I like to have people between 50,000 and 100,000 milligrams per treatment, but you need to make sure that there are other things in that treatment protocol, such as magnesium, calcium, and there's a specific ratio that you need to use of about twice as much calcium to magnesium. You want to have some B vitamins in there. If you're tested as positive for the MTHFR gene, which I think is a really good test, if you're not methylating or detoxing correctly, it can be a significant hurdle or problem in your Lyme disease treatment. So understanding if you're basically sensitive to B vitamins is really, really important in designing your IV protocol. Other things that are a good consideration in addition or in lieu of antibiotics is to do some 1 to 100 hydrogen peroxide therapy, which means you take a 1 cc of hydrogen peroxide, you have 100 cc's of a carrier solution, typically D5W. You add a little bit of manganese and magnesium so you don't get phlebitis or vein irritation. But I've seen really neat outcomes with people that have chronic Lyme disease when you get a 1 to 100 treatment of hydrogen peroxide. It's an IV treatment, and then the last thing that I really like to see in just an IV protocol, and that doesn't include the mind-body therapy, that doesn't include touch therapy or neural therapy, but in an IV protocol, what many doctors are missing is they don't know how to flush the lymph nodes, or they don't pay attention to the lymph nodes. Now, your lymph nodes are your infection processing centers. So as we have this bacteria that's in the system and going out, it's in the organ system, basically the white blood cells are responsible for identifying and starting the killing process of the bad guys. The white blood cells are like trucks on the freeway. They take the bad guys and they take them to jail. They're like state police officers. The white blood cells identify the bad guy, take them to jail, which is your lymph nodes, which are your tonsils, your lymph nodes, your spleen, and your Peyer's patches in your body. And if we get the bad guy there and those cells those jail cells get overloaded, you can't process any more infection. And a dilute hydrochloric acid therapy has the amazing ability to flush your lymph node system. Now, this is done in a medical paper called 3 Years of Hydrochloric Acid Therapy. It was about a doctor that went to Africa some time ago and had some amazing outcomes for chronic infection. And he wrote a paper why he thought dilute hydrochloric acid therapy was so important for lymph node flushing. The paper gives us amazing resources of how to get those jail cells flushed. So hydrogen peroxide, IV therapy, vitamin C therapy, hydrochloric acid therapy. In our office, we call it the 3-bag protocol, where I actually do it in succession, but flushing lymph nodes is really important. Now, there's some vitamins, there's some minerals, there's some herbs that are really good for flushing your lymph nodes, and that's really, really important to do whether you're doing an immune system stimulation protocol or you're doing an antibiotic protocol. Don't forget about the lymph nodes. Now, in Western medicine, we have a tendency to forget about a very, very important organ, and that's the spleen. Now, the spleen is like a blood reservoir, but it's so important for your immune system. And in medicine, we have a tendency to forget it. But there's some specific proteomorphogen therapy, and there's some specific ways in neural therapy to stimulate the spleen to speed up the way that you can process an infection. So to summarize, Lyme disease is a very clever organism. It goes to where you're most weak, and it has a tendency to create a myriad of symptoms. If you put 40 people in a room with chronic Lyme, you'll typically see 40 types of symptoms or presentations. The most common ones that I see are bad stomach, inability to sleep, pain all over, can be migrating joint pain, a lot of muscle aches, and just an overall muscle weakness. That's kind of the classic presentation of a chronic Lyme patient, and they get frequently misdiagnosed with fibromyalgia or chronic fatigue syndrome. Now, the traditional medical approach is to give antibiotic therapy. I think there's a better way to treat that with immune system stimulation therapy, balance therapy, and in the immune system stimulation therapy, high-dose vitamin C, dilute hydrogen peroxide, and dilute hydrochloric acid get really, really amazing outcomes. And it's not just me saying it. I have hundreds of video testimonials on our blog, www.dailydosevitaminH.com, where we're taking people that were in wheelchairs, that thought they were going to die, that thought there was no hope, that were out of time, out of options. And we've been able to help them get their life back and get their health back. This is Dr. Jason West, and we'll see you on the next Lyme video.